Eczema, also known as atopic dermatitis, is a chronic skin condition that causes inflamed, itchy, and often cracked or rough patches of skin. It can occur at any age, but it often appears in early childhood and can persist into adulthood. The name eczema comes from a Greek word that means to boil over, which is quite fitting considering how the skin can appear red and blistering during flare ups. People with eczema have a skin barrier that's less effective at retaining moisture and protecting against irritants, allergens, and microbes. This compromised skin barrier leads to the characteristic dryness, itchiness, and inflammation. Eczema is incredibly common, affecting millions of people worldwide. It's estimated that about 10 to 20% of children and 1 to 3% of adults have some form of eczema. It tends to be more prevalent in urban areas and developed countries, possibly due to environmental factors like pollution and lifestyle differences. Causes of eczema. The exact cause of eczema isn't fully understood, but it's believed to result from a combination of genetic and environmental factors. Number 1. Genetic factors. People with eczema often have a family history of the condition or other related conditions, such as asthma and hay fever. This genetic predisposition suggests that there's an inherited component that affects the skin's barrier function. Number 2. Immune system. Eczema is associated with an overactive immune system response. In people with eczema, the immune system tends to overreact to small irritants or allergens, causing inflammation and the classic symptoms of the condition. This hypersensitivity can make the skin more reactive to various triggers. Number 3. Environmental factors. Many environmental factors can trigger or exacerbate eczema. These include allergens like pollen, dust mites, and pet dander, irritants such as soaps, detergents, and synthetic fabrics, extreme temperatures, and dry skin. Stress and hormonal changes can also play a role in triggering or worsening eczema flare-ups. Number 4. Microbial factors. Certain bacteria, particularly Staphylococcus aureus, are commonly found on the skin of people with eczema. This bacteria can exacerbate symptoms and lead to infections, which further irritate the skin and make managing the condition more challenging. Symptoms and how they feel like. The most common symptom is intense itching, which can be especially bothersome at night and interfere with sleep. This itchiness often leads to scratching, which can create a vicious cycle, as scratching can damage the skin further, leading to more inflammation and itching. The skin affected by eczema typically appears red, inflamed, and may have small, raised bumps. These bumps can sometimes ooze or crust over if scratched excessively. Over time, repeated scratching and rubbing can cause the skin to become thickened and leathery, a condition known as lichenification. In addition to the itching and inflammation, people with eczema often experience dry, sensitive skin that is prone to cracking and bleeding. This dryness can make the skin feel tight and uncomfortable, and the constant itching can lead to a persistent feeling of discomfort and frustration. Eczema can appear anywhere on the body, but it commonly affects the hands, feet, ankles, wrists, neck, upper chest, eyelids, and the insides of the elbows and knees. In infants, it often appears on the scalp, cheeks, and chin. Diagnosis of eczema. Diagnosing eczema usually involves a combination of medical history, physical examination, and sometimes additional tests. When you visit a healthcare provider with concerns about your skin, they'll start by asking about your symptoms, when they started, and any patterns you've noticed. They'll also ask about your family history of eczema, asthma, or allergies, as this can provide important clues. During the physical examination, the doctor will carefully examine your skin, looking for the characteristic signs of eczema, such as redness, inflammation, and the distribution of affected areas. They might also check for signs of infection or other skin conditions that can mimic eczema. In some cases, the doctor may recommend additional tests to rule out other conditions or identify specific triggers. These tests might include: Number 1. Patch testing. This test can help identify specific allergens that might be triggering your eczema. Small amounts of potential allergens are applied to patches, which are then placed on your skin. After a couple of days, the patches are removed and the skin is examined for reactions. Number 2. Blood tests. While blood tests aren't typically used to diagnose eczema, They can sometimes be helpful in identifying elevated levels of immunoglobulin E, which is associated with allergic reactions. Blood tests can also help rule out other conditions that might be causing your symptoms. Number 3. Skin biopsy. In rare cases, a small sample of skin may be taken and examined under a microscope to confirm the diagnosis or rule out other skin conditions. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for eczema. There's no cure for eczema, but various treatments can help manage symptoms, reduce flare-ups, and improve quality of life. Treatment usually involves a combination of lifestyle changes, skincare routines, and medications. Number 1. Moisturizers. One of the most important aspects of managing eczema is keeping the skin well moisturized. Moisturizers help restore the skin's barrier function, reduce dryness, and protect against irritants. It's recommended to apply a thick, fragrance-free moisturizer several times a day, especially after bathing, to lock in moisture. Number 2. Topical corticosteroids. These anti-inflammatory creams and ointments are commonly prescribed to reduce redness and itching during flare-ups. They come in various strengths, and your doctor will recommend the appropriate one based on the severity of your symptoms. It's important to use topical corticosteroids as directed to avoid potential side effects like thinning of the skin. Number 3. Topical calcineurin inhibitors. These non-steroidal creams, such as tacrolimus and pimecrolimus, are used to reduce inflammation and itching, particularly in sensitive areas like the face and eyelids. They are often prescribed for long-term use and can be an alternative to corticosteroids. Number 4. Antihistamines. Oral antihistamines can help reduce itching, especially at night, allowing for better sleep. Some antihistamines have a sedative effect, which can be beneficial for those struggling with nighttime itching. Number 5. Immunosuppressive drugs. In severe cases of eczema that don't respond to other treatments, doctors may prescribe oral or injectable immunosuppressive medications like cyclosporin, methotrexate, or biologics such as dupilumab. These medications help control the overactive immune response, but require careful monitoring due to potential side effects. Number 6. Phototherapy. This treatment involves exposing the skin to controlled amounts of natural or artificial ultraviolet (UV) light. Phototherapy can help reduce inflammation and itching in people with moderate to severe eczema. However, it requires regular visits to a healthcare facility and can have long-term side effects like premature aging of the skin and an increased risk of skin cancer. Number 7. Lifestyle changes. Managing eczema also involves making certain lifestyle changes to reduce exposure to triggers and support overall skin health. This might include avoiding harsh soaps and detergents, wearing soft, breathable fabrics, and keeping the home environment cool and humidified. Stress management techniques, such as meditation, yoga, or counseling, can also help reduce flare-ups triggered by stress. At the end, remember that managing eczema is a journey that requires patience and persistence. With the right support and strategies, it's possible to live well with eczema and minimize its impact on daily life. Now, we want to hear from you. Do you or someone you know have eczema? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.